Good afternoon, and thank you for joining us today. We're really happy that you're going to talk a little bit about PeriActive. So I'm going to start off by asking you to briefly tell us a little bit about yourself, your name, and so on.
Hi, I'm Rosanne. Just turned 51, and I live in Pound Ridge, New York.
Great. So, how long have you been using the PeriActive, and how did you get started? Why did you start using it?
So I've been using PeriActive since let's see, it was like May of this year. So I had I had implant surgery, and the surgeon recommended, gave it to me to use, and I really thought it was a great product. So actually every time he was prescribed it per se, every time I would see him and he would check the healing, he would give me more and say continue rinsing, and I really felt like great relief when I was using it, especially initially right after the surgery. I really enjoyed it, so then I just continued using it, and seeked it out myself to buy it because I couldn't keep asking him for it.
Uh-huh.
So
Well, that's great.
mhm.
It's PeriActive is fantastic for surgery,
Mhm.
especially because it's a wound and it's inflamed. So that's what the product really focuses on, reducing inflammation and healing that tissue. So
Mhm.
it sounds like that's when you say, it just felt better. Is that fair to say that that's kind of what you felt like was?
Absolutely. It was like the tenderness and the soreness, and it would just immediately, relieve it after a while, doing the rinse. And he had prescribed, I want to say I was rinsing initially, I think 3 to 5 times a day. I forgot, but I was doing it like every time I would just go into the bathroom, I was rinsing because it helped. And
Right.
I also, I don't like taking a lot of pills and stuff. So I liked using this natural, ingredient product more than taking Tylenol or taking whatever, anything.
Uh-huh. Yeah.
And so I just kept using it, and I used it often.
Uh-huh. Good. So you're continuing to use it.
Mm-hmm.
Yeah, that's great because
Yeah.
it's actually a preventive as well. So if you
Mm-hmm.
have a specific problem rather, excuse me, it will really help accelerate that problem. And then if you continue to use it, it'll certainly prevent, things
Mm-hmm.
down the
Yeah.
road. So that's great. So um so have you ever tried any other products, and if so, did they work?
I mean, over
The
the
difference.
years, I've definitely used things like Listerine or Scope or, but to me, it's totally different. The Scope, the Listerine, let's say, would be the most I would use because I always felt like, oh, it's medicated, help, but it totally different. Like that was so, like rough, like, you know what I mean, like so spicy and strong, and you didn't feel that actual relief that you feel from the PeriActive. Like it was very different. So now I really just don't use anything other than the PeriActive because I like it better. And again, I like it because it's natural ingredients, so
Uh-huh.
that makes me, more comfortable with it too.
Right. Yeah. It's a homeopathic product. It's
Right.
not totally 100% natural. However, it
But
is
it, mhm.
plant-based. So it's
Mhm.
really one of the best products in terms of a little bit more natural than other products on the market.
Mhm.
So
Yeah, I mean, I've tried to compare, and I don't find anything has the similar ingredients to it. So
yeah, it's
definitely
unique.
unique. Yeah.
Yeah. I know. Well, I'm so glad that you have relief. I know I hear often from patients that it soothes their mouth when
Mm-hmm.
they have, any kind of procedural work done, if they
Mm-hmm.
have gingivitis and or periodontitis, or any kind of period problems,
Mm-hmm.
surgical. Um, so is it fair to say that since you've started the PeriActive, are you getting, better? How long, it's been, you said started in May. It's not that
Oh,
long.
it
So,
definitely helped the healing process. It took a long time because I had kind of an involved situation with, like bone graft and all this other stuff. And so
right.
I actually had two surgeries. And then of course, when they had to open it to then prepare for actual teeth, I used it again, and so that's true. So I actually used it even because the surgery implants was last year and then the opening was this year. So I've
Uh-huh.
actually used it both times he gave it to me. And I definitely feel that it was beneficial to the healing. And even now, like, just if you feel like you have like a little like kink or sore or something, anytime I use it, I feel like it just really, like you said, it soothes, like it just clears it up very quickly comparing to anything else I've ever had.
Yeah, great.
Yeah.
Well, I'm really delighted to hear that you had such good results with it. And would you recommend PeriActive to someone suffering from gingivitis or periodontitis or
Actually, yes, and I don't know if I mentioned this to you when we talked before, but my husband is started using it
okay.
because he was having like a little bit of I don't know, like a little discomfort like in his one of his teeth. So I was like, oh, in his gum specifically was like bothering him. So I said, try it. And he like totally loves it. And I actually my mom, I recommended it to her too. And when I ordered it for myself, gave her some and she thinks it's great too. So
Uh-huh.
she's been using it, she says she told me today, she said that whenever she feels like a little off with something, she goes, I use it right before I go to bed. She goes, and it, feels great. And then like I wake up in the morning and I feel so much better. And I'm like, so she uses it too. So definitely I do recommend it to others.
Uh-huh. Yeah. Okay.
Mm-hmm.
Well, it's great that you're doing that and it's helping people, and
Mm-hmm.
it's really good to hear. So it sounds like you're a fan of PeriActive. Is that fair to say that
Absolutely. I
yeah.
am a periactive fan for sure.
Okay, great.
Mm-hmm.
Well, again, thank you so much for sharing that and giving us feedback. And it's great to hear that you've had really good results with that and your family as well. So
Mm-hmm. Definitely.
thank you for sharing that.
My pleasure.